Thank God for the wake up. Thank God for the wake up. Thank God for the wake up. God morning and good morning, everyone. I am your host, Luis Lopez, and you are tuned in to Talking Cancer, my journey, my way, where I am willing myself to heal myself. Of course, all of that by the grace of God. Um, this show is geared personally just to talk about um, my journey, your journey. Um, as I as I get ready to enroll people's other people's past, it is very important to me, that that I don't get lost in the shuffle of other people's story as well. Keeping making sure that my journey is relevant in where I'm at mentally, physically, things like that. So as I get ready to unroll this carpet of different people and their journey and embracing their journey and not being and making sure that I am biased because everybody's journey is theirs and making sure that I respect their journey. I I had a had the pleasure of talking to a friend of mine yesterday, who was diagnosed with stage 3 breast cancer, and um, in her journey. And we're just talking. She just kind of picking my brain. She got diagnosed at stage 3. Um, she is someone that has been on top of her exams, things like that, uh, and the issues that she has. Um, things were uh, diagnosed as just like fibroids or a cyst or whatever, and never really taken to the next level of saying, hey, let's go get this checked, make sure it's not cancerous and things like that. Um, and I don't know how often these things happen where now you're diagnosed in a late stage, and puts you in fight or flight type mode, like where you're just super reactive, and you could have treated this a lot differently had had there been that proposal. And I don't know if it's a uh, people of color type of treatment or um, maybe a type of insurance that someone may have, a lower class, but it's a common theme, it seems like, that we're going through, where things aren't that important, you know, to the doctor for whatever reason. You know, certain people are just not as important to say, hey, you know what, this looks suspicious. We definitely need to get in there and do a CT, a PET, a MRI, just to, a biopsy maybe. Hmm. Check this out and make sure. You know, she could tell the story better than I can, but the fact of the matter is, it seems to be a common thread. Something similar to how I was approached. They approached when I first went. They approached mine as Um, I had bacteria. Um, what was it? H. pylori. They approached it that way, and in the fine print, they suggested that I get a colonoscopy. I didn't even pay no mind because our conversation was so heavily saturated on on discussing H. pylori that you know that kind of flew under the radar because the doctor didn't make it. Um, we didn't discuss. I think we might have mentioned it, maybe, but never really addressed it. Like why I should go and get this, and I highly recommend you go get a colonoscopy because you do have blood in your stool, and there's a possibility of something else going on. Like this. There's no sense of urgency whatsoever, and my friend is having that same similar type of issue, you know, and now here she is at stage 3. You know, it, the inequities of the medical world to people of certain um, maybe skin color, excuse me, maybe skin color, the inequities of people's sexuality, the inequities of people's health insurance or social status. You know, I'm pretty sure money has a big part to do with it, and just being, um, for me, I was medically naive about terminology and things like that. Still am working on, being more proactive and trying to understand terminology and what it means. But I have to do my own because doctors don't really explain. But then again, if you don't know the questions to ask, they will not tell. You know, giving you the bare minimum, at least in my experience. You know, there are a lot of good experiences, but now I'm here talking to another person of color with a similar story. You know, to say the least, not cool, not cool at all. So we continue just to push the line, push the narrative to get the message out of pushing. If you're out there and you're going to the doctor and you have issues, stomach issues, breast issues, lung issues, pain, things that they call cysts and fibroids and all of this stuff, push the issue on getting a biopsy, getting tested, getting PET scans, things like that. PET scan is probably one of the easiest things to do because they put this, radiation type glucose in your system, and it just goes in your system, and they see, because cancer loves sugar, so the sugar goes straight to the cancer to feed it, and it highlights it in bright yellow type thing, and it'll tell them like off top, yeah, you got cancer, boom, because they don't always sometimes come out in your blood markers and your labs and things like that. You could be looking normal. So, and with that being said, it's just one of those unfortunate things that I or my friend have to go through, because now we have to battle this at a different stage, at a different level, when we definitely could have been more proactive a long time ago. Me, I had the opportunity to catch mine a year prior to my diagnosis, and now there's nothing I could do about it. I mean, I tried to speak to a lawyer. A lawyer won't even talk to me because it's past the statute of limitations for my original diagnosis. And that's the frustrating part, what I mean? Because, you know, things like this, medical malpractices and things like that, just completely just wrong. Completely just wrong. But that's okay, because I'm going to cure myself anyway and let them know that, look, my platform is not going anywhere, and I'm going to continue to speak and, make people aware. Doesn't matter who you are, but you need to be aware. And my focus is my gear focus, main focus on the inner city. Yes, you know, but my message reaches everyone. But I'm looking to change a dynamic, from a perspective of making sure that the minority community or people of color or um, people from a less socioeconomic status, and just making them aware, you know, this is not just about me talking about my cancer. You need to become aware that you have to fight just a little bit harder to be heard, fight a little bit harder to dive into words that you're unfamiliar with and finding out what they mean because of whatever, because of the type of insurance you may have, or the lack of knowledge that you may have, or the color, God forbid, the color of your skin, or maybe even the way you classify your sexuality. They may look at you different. I don't know. Depends on the doctor. It's very, very far in between where you get a doctor who truly cares. You know, um, most doctors, from what I see and what I've dealt with, it just deal with the more of a repetitious type thing. This is not a repetitious type of um, environment that they are in. There's a lot of jobs that you could go to that you go in, clock in, and everything's the same every day. You know, being a doctor is not one of those. Every person is different. Every issue is different. Everybody, every everybody's chemical makeup, molecular makeup, the human biology, everyone is different. And they're now starting to take some of that approach as far as the scientists that are looking into cures and things like that. But from a doctor's standpoint, a lot of doctors deal with the patient as a just another patient, just coming in same like the other. And it's very unfortunate that this type of mentality, as a doctor patient type relationship, is in effect. So again, this show is about awareness, not just about my journey, but the awareness comes from my journey and my experience, from having stage 4 metastatic cancer right now. And it's very important to me to keep the awareness alive, to somehow find a way to get to the inner city and speak on these things, speak about health, speak about wellness, speaking about being proactive about what's going on with your body, listening to signs, promoting good eating habits, exercise, letting you know that you are in control when you are in the doctor's office. The doctor does not have the final say so of things. Letting you know that you are the boss. Without you, the doctor does not get paid. And you are more than welcome to break up with your doctor, fire your doctor, and find a new one that works for you. You have that option. Put your doctor through an interview type process. They work for you. And if they're not listening or brushing you off and you don't like it, you have the right to find another doctor. So keep these things in mind as you are going through whatever it is that you're going through. Be aware, make yourself knowledgeable, investigate the words and terminology in which the doctors are using to make sure that you're getting the best type of treatment that you possibly can. Because being misled is a crime. And it's unfortunate that I can't do nothing about it because of the statute of limitations. But that doesn't mean that I can't speak on it and help the future of people that may be going through something similar. Today I was actually supposed to talk about new innovations and advancements in cancer and stuff like that, but this kind of pulled me another way because my show it revolves around a lot of different components, and I want everyone to be armored with their basic human rights. Stick to your beliefs. Stick to your core values. Use your voice. The doctor's not always right. If you feel something's wrong, speak up. And if they're not trying to hear it, they're not trying to hear you, then fire them. Break up with your doctor if you need to. There are plenty of good doctors out there. You just got to find them. Plenty of doctors that care. Plenty of doctors that practice integrative medicine. Find them. You have to do the work. Until next time, thank you. I appreciate you. Don't forget to tune in. If you feel like talking to me, please reach out. Cancer, my journey, my way at gmail.com. Don't forget to hit the like, follow, share button on any of my social media platforms. Definitely would like to just continue pushing the issue of talking cancer. That's bigger than me. It truly is. So please follow, share, do all of those things that social media requires to get the word out. Change the algorithm and things like that. Again, I appreciate your time. That's me. Peace, love, one.